let's have a quick look on what our project and this series of webinars is about. Evolve to Care actually streamlines experimentation in health tech by bridging the gap between living labs and transitional care. It aims to standardize processes, improve collaboration, and overcome market delays and regulatory challenges. So by leveraging a network of living labs that are around Europe, Evolve to Care provides a shared marketplace for experimentation, helping overcome delays and any other regulatory challenges. So the main aim of this project and this series of webinars is the creation of an ecosystem and framework that brings together innovators developing new healthcare solutions, researchers that study the impact of these solutions, regulators ensuring compliance and safety, and of course other stakeholders such as hospital, healthcare organizations, caregivers, and patients. Today's workshop will mostly be on bridging the challenges for healthcare domain. So some in primary needs analysis that we have done, some specific needs that we discovered and we are aiming to solve is traditional care improvement, of course. Faster go-to-market in health tech innovation. So quicker response to healthcare needs, developing fast competitive advantages. And of course, knowledge enhancement and collaboration between all these different stakeholders. So today we are going to see the perspective of a healthcare person, such as Kostas Bakogiannis, who has also been included in many research programs and entrepreneurs programs. So now I'm going to stop sharing and give the floor to Konstantinos. Thank you again for joining us, and it's an honor for us to have you here.
Yeah, it's a pleasure also for me. And I want to thank you for this kind invitation. And I should assume it's one of the topics that we have regularly discussed in the past. So I hope that in the next minutes I will try to give the perspective from our side, from my side as a physician, as a cardiologist, but also indirectly being in close contact with the patients and the caregivers, how we also they see the tools and the digital innovation and how it should be managed so that it could be used more frequently in their daily life. So I will share my screen. Please let me know if you see it.
Yeah, it's great. Thank you.
Perfect. So I've as we've discussed, I'm a cardiologist. So and it maybe you know that cardiovascular diseases is among or the first cause of mortality and morbidity worldwide. Also in Greece, but also in other countries all around the world. It's far more major problem and a burden. Health burden, economic burden, and social burden compared to other diseases, despite the fact that we have a lot of therapeutic innovation the last year. So our question is, and what we also discussed in our clinic is, could digital health tools and innovation be a catalyst for improvement? It might be a solution to close this gap between what we see in clinical trials, what we expect with our therapeutic options, and what actually the reality is. And we want to examine how this is realistic. Just a very short overview. In 2018, with my doctoral students, we started the Digital Cardiology Lab, the Cardiovascular Prevention and Digital Cardiology Lab. And the idea is actually to create tools that will bring closer to our clinic the patients in order to improve their adherence with their treatment, as well as their communication with us. One of the first projects was the THES-HF project, the THES Heart Failure project, which was the development of a patient-centered app for heart failure patients. Our idea was an app that will be user-friendly, that will help them to adhere to their treatment, and as I told before, to improve the relationship with the heart failure clinic. We proceed with a clinical validation study, usability, the SHF study, which shows, demonstrate to us, we gain from this study very important insights. We have from the one side, during the 3 months used a significant increase of the self-care level and a slightly improved quality of life. But on the other hand, during our communication with our patient, the adherence to the use of the app dropped significantly after the second month and more significantly after the third month. That actually meant to us that the way that the app functions is not so user-friendly as I thought it was. That's why we have this drop of adherence. In the meantime, we have worked in other projects also together with the Medical Physics and Digital Innovation Lab of the Aristotle University of Thessaloniki. And actually, and not not to waste your time, actually, based on all this experience and all this discussion, I will share with you what we think actually from our perspective that might be helpful to further bring this innovation closer to the patient and the healthcare professionals. From the one side, we have the clinical reality that we have to face, and that is that in most of the cases, we have a lot of patients to handle. There are time constraints, and we battle a lot with burnout because of all this overload. This happens in Greece, but believe me, discussing with colleagues all around the world, the recent years and especially after COVID, due to many reasons, these problems are more or less global problems. On the other hand, we have a lot of user-centered digital solutions, and I think that we should agree, or I will leave it as a topic for discussion. In most of the cases, the solutions that we have and that we use, they promise a lot, but the reality tells us that they are not so promising as they say they are. In addition, we should think that we live and we act in an ecosystem. So having the patient in the center of the digital innovation and digital solution, we should try to find the way to bring together the needs and satisfy the needs from various stakeholders, like the caregivers, the policymakers, the healthcare administrators, industry, the IT developers who works with us. On the other hand, and in addition to this, we have also a lot of other problems to face in this sector. We have the regulatory, legal, and financial challenges to address. And to be more specific, we have data privacy challenges, cybersecurity challenges. In many cases, we have interoperability problems and a lack of harmonized health technology assessment process to be sure that the tools that we use or our patients use are validated and they are evaluated via a regulatory framework that is well accepted globally, or at least in Europe or in a country. In addition, we face the high cost of digital health tools, which I should assume that during the time they are getting cheaper and more affordable. We have the lack of cost-effectiveness studies, which is a constant discussion with the healthcare administrators, because when we go as a healthcare professionals and we tell them that we will gladly use a new platform or a new tool, digital health tool, to provide a better care to our patient and improve workload, they ask for cost effectiveness study. They ask for the health economics behind these tools. And of course, there is actually in Greece or in many European countries, there is no reimbursement model in place for the users. And of course, a very important and crucial topic is the digital health literacy. Is it, as I usually say, is we have the innovation now is really magnificent. We have a very interesting and very important tools, wearables, IoTs, digital health platforms, and AI to to assist and enhance all this the data that we take from these tools. On the other hand, the users and many users, both from the patient and caregiver side, but also from the healthcare professional side, they don't know how to use them. So it is like you give a Ferrari or a very very good car and that a very fast car to someone that do not know to drive or doesn't know how to use it. In addition, when speaking about and discussing about artificial intelligence, there are some challenges that many healthcare professionals in our discussion or in the discussion with the industry that they suggest to us that we should use some of these AI tools. There are these topics that they are often discussed and they seem to be an obstacle or a challenge, and that is the lack of trust in AI, the bias which is closely related to the data, and there is also a big challenge to create and to have access to harmonized and qualitative data in order to build accurate models and to have also very accurate results. And of course, there is the problem of black box and lack of transparency, which through the explainable AI or other methods, I hope that we will have in a very short time a very good results. So from my side, and not only defining and highlighting the challenges and the problems, the solutions that I see, and that is also a topic for discussion, is the first one is to align the innovation with the clinical needs, and that means that we should come closer, all the stakeholders, and learn to speak and discuss in the same language, meaning that we should, in many cases, co-design solutions. We should keep in mind that the user and the end user and the intermediate user, so that we can design human-centered and user-centered tools. And of course, a very significant topic is the integration into clinical workflows and the interoperability with other systems and tools that we normally use in our daily clinical routine. Of course, there is a great need for policy and regulatory adaptation. Normally, we see that it takes a lot of time to bring legislation at the European level and then to implement it to each country. So we need to be more flexible, and we should have fast-tracking approval pathways, of course, always aligned with the existing policies for data privacy and security. The financial and the reimbursement strategy is another topic that should be and we should keep in mind, and that's why we need the cost effectiveness studies so that we can build value-based reimbursement models. And I think that because health and digital innovation is something that that concerns a lot of stakeholders, we should build partnership and we should be very creative in order to fund the development and the implementation of this solution. So when discussing about AI, I think that we, as I've discussed, explainable AI and bias mitigation strategies should be in use and should be explained to the users. And of course, we should always keep in mind that AI actually is a supportive tool, and it will not, at least in the near future be as another doctor or as another healthcare professional. It could not substitute the persons and the professionals. And of course, I think that the physician and patient education and the digital literacy is a crucial topic. Digital health training should be also implemented into medical education. I think that there are many universities and many medical schools that they have started implementing digital health training. Of course, there is a growing need for workshops and training programs for patients, caregivers, and healthcare professionals, and we should also try to find creative ways in order to engage our patients to use correctly such digital health tools. For example, in Thessaloniki, we have started in our clinic the cardio school, which key objectives are to improve the health literacy of the patient, and working together with the medical physics and digital innovation lab, our objective is to significantly improve their digital health skills. So to conclude, I think that we all agree that digital innovation has the potential to revolutionize transitional care. Key barriers include regulatory hurdles, financial constraints, physician resistance, interoperability challenges, and digital literacy gaps. And the successful implementation requires co-designing solution, flexible regulatory framework, sustainable reimbursement model, training and education for physicians and patients. Thank you very much.
Thank you very much, Kostas. That was very insightful. I would pass the floor to the audience for any further questions or any points of discussion, because a lot of interesting points were raised. Do we have any questions? Otherwise, I will ask you some. Yes, Despina, please.
Hello. Thank you for the very interesting presentation. I would like to ask you, from your point of view and from your experience, of course, what would you think is, like, if you have to choose one solution of all the problems that you mentioned, like if you would put something as a priority of how to solve all this, what would it be?
That will be the digital health literacy. I think that there are a lot of people among physicians, among healthcare professionals, but also among stakeholders that they have not fully understand, that they do not understand the use of the tools, how to use it, and how to optimize the outcomes based on the use of digital health tools. So education and training, it's crucial. It's like what I've told. We have amazing tools, and we have a lot of data, and we can create a lot of data. But if we do not know how to use the tools, that makes no sense.
If I may add to that, I don't know, Vestina, if you want to add something, because I fully understand your point, and I know that the technological improvements have been absolutely crazy in the last years. But the main problem that we actually get from doctors and healthcare professionals in general is the time, that they do not have enough time to integrate all these technologies in a hospital environment. So how do you deal with that, or what motivates you as a doctor and your team to actually try these new technologies in your everyday practice, actually?
Yeah, that's very, very nice question, actually. Do you know, the first thing is that you should make it easy for the user to use it. Okay. And that's why I told that co-design solution and work together with the users might be a solution for the user to be more motivated to use them. in addition, you have to show him, or you have to have data demonstrating that if he will spend, let's say, an X time, then he will improve the overload, because the use of these tools will really help him and improve his daily workload. Okay, that are the things that are very important. And the other very important thing is what I've discussed, what I told about interoperability. The problem is now that we have a very fragmented platform of tools, let's say. We have another platform for the lab exams. We have another platform, digital health platform, for the discharge summaries. We have another platform if we have a heart failure patient, and another if we have a patient with coronary artery disease. So you can understand, if you tell him, okay, I have another tool to use, you drive him crazy. So the best is that you can, I don't know if it is possible to have all-in-one, I'm not so sure, but at least you will try to create systems that are very interoperable so that they will ease their use.
Yeah, that's a high priority, I think, for most doctors, especially in the Greek healthcare system. It's a very big issue. And thank you for your answer.